I'm in.
I love it.
And I got a pair of compulsive disorders here.
J'ai une question. Comment les psychiatres peuvent-ils parler de faits démontrés quand ils n'ont rien prouvé?
C'est pire que ça. Non seulement les psychiatres n'ont pas de test pour prouver les étiquettes qu'ils vous collent, ils ne peuvent pas définir ce qu'est un trouble mental.
Non.
C'est même écrit dans le DSM, regarde ça.
Although this manual provides a classification of mental disorders, it must be admitted that no definition adequately specifies precise boundaries for the concept of mental disorder. There you go.
Incroyable.
Mais les psychiatres n'avaient pas encore fini. 14 ans après le DSM-3, ils ont publié le DSM-4 et son rédacteur en chef fut encore plus direct en ce qui concerne le terme trouble mental.
There is no definition of a mental disorder. It's bullshit. I mean, you just can't define it.
Donc, tout en admettant qu'ils ne pouvaient pas définir ce qu'était un trouble mental, terme qui est dans le titre de leur propre manuel, ils en ont rajouté encore d'autres.
Beaucoup d'autres. 115 pour être précise, ce qui fait 374 au total.
C'est 3 fois plus le nombre de troubles donnés dans le DSM-1.
En à peine plus de 40 ans. Et le livre pèse plus de 2 kilos.
C'est plus gros que l'annuaire téléphonique d'une grande ville.
C'est un catalogue de maladies mentales. Et il a servi à faire le diagnostic de 120 millions de personnes dans le monde.
Ça alors. Mais qu'en est-il de la classification internationale des maladies? Y a-t-il eu un accroissement des troubles mentaux là aussi?
Absolument. La section des troubles mentaux et du comportement de la CIM est pratiquement parallèle au DSM. Les changements dans le DSM sont reflétés dans la CIM.
D'accord. Bon, jusque-là, j'ai appris qu'il n'y a pas de test pour identifier ou confirmer le diagnostic d'un trouble mental, que la théorie du déséquilibre chimique est sans fondement et que les psys ne savent pas ce qu'est un trouble mental.
Et ils l'admettent, du moins entre eux. Voici un extrait d'une récente convention de l'Association psychiatrique américaine.
You're sitting in your office, you see a depressed patient, you have no idea what's the matter with them. And I know all of you think you know the answer, but in terms of evidence, I don't know the answer, and I don't think any of us really know.
C'est stupéfiant.
Et pourtant, ils sont très prompts à vous donner un diagnostic. Voici un autre psychiatre influent à la même conférence.
Jim Burley at the Maudsley Hospital did a study once on how long it took people to make up their mind about the diagnosis after they entered a room. And it was about, how many, David? It was 2 seconds? It was a couple of minutes. It was very...
Dans les 2 minutes?
Ouais. Même le président de l'Association psychiatrique américaine a dit que le DSM était plus ou moins une blague.
Well, what does D stand for? I used to think it is diagnostic, but over the last few years realized it is more like a dartboard.
Jeu de fléchettes? Est-ce que les psychiatres disent ça à leurs patients?
Non. Ils se comportent comme s'ils savaient de quoi ils parlent, tout en tenant le public dans l'ignorance.
I was sent to a psychiatrist who saw me again for maybe about 15 minutes, talked to me how I was doing at 7 years old, and I left with a prescription for Ritalin.
Probably within the first 15 minutes, he diagnosed me with having an anxiety disorder and put me on prescription medication.
The amount of time it took for the diagnosis was, I'd say, probably within 10 minutes I was diagnosed with anxiety, with depression, within 10 minutes of speaking to the psychiatrist, and I was put on those drugs immediately.
I received numerous different diagnoses from different doctors, and each one gave me a different drug.
I didn't have to undergo any tests. I didn't even have to sit there and I didn't have to ask any questions. It was just, that's what you've got. And this is the drug.
They really didn't talk to me. They were always talking and questioning my mother. It was all about getting the information from her and not from me.
It doesn't make sense to me. I researched it, I've done my research, and I still can't fully understand how you can diagnose somebody with a short attention span.
There was never an explanation. Nobody really knew what it was or why it was caused or how did you get it, why did anybody have it, and what could anybody do about it. Just here, have some medicine and go away.
And I was put on, a horse's dose of an antidepressant called Effexor, 450 milligrams a day. They say if you're on 300, you're comatose.
It wasn't always Ritalin. It was Went from Ritalin to like Wellbutrin to Concerta to Adderall.
I remember asking these doctors, is there any other way we can do this? Is there any other therapy? Is there something we can do that won't make me feel so badly, that won't give me all these side effects and just horrible sensations through my body 24 hours a day? Is there something else I can do that might be not having to do with medications? Doctor said, no. See, what you have is very complex. You have a chemical imbalance in your brain that the only thing that can correct it is medication.
Allons bon, ça fait beaucoup de diagnostics, mais ils ne sont suivis que de médicaments.
En effet, de nos jours, un diagnostic psychiatrique implique une drogue psychiatrique.
The whole question then becomes, okay, if we apply these labels, what next? And the what next tends to be, you get a prescription. And the prescription is for a drug that doesn't work very well and is toxic.
It's like a 1-2 punch. The number one of the 1-2 punch is the diagnostic manual. You've got all these disorders to choose from. The two is the treatment. So you've got the diagnostic manual in place, you've got a machinery in place, and then you've got this treatment that is there for the taking.
For everything you can think of that might seem to be odd behavior, the psychiatry field has a name for it. And then for every name of every diagnosis you have, there's going to be pharmacology behind it, and they have a pill for it.
Let me fan it out and pick a card, and there you go. Here's your label, and there's the drug that we'll give you to go along with that label.
98%, maybe 99% of people will get a diagnosis that justifies the use of a medication and also a follow-up appointment. Because remember, the business of medicine, the business of psychiatry, is seeing patients. And the psychiatrist that tells a patient they don't have a problem and there's no medicine for that problem doesn't have a very busy practice.
And that's sort of the purpose of the DSM 345, to provide a diagnosis that can be given a drug for that patient.
It's a quick buck. You don't need to do a physical exam. You put it in the chart, it's done. Prescribe away. Lifetime patient. That's what the DSM is for.
Sont-ils en train de dire que le DSM n'existe que pour justifier la médication?
Je crains que oui.
Oh, dis donc. Si le traitement principal de la psychiatrie est la médication, il doit s'en faire beaucoup des prescriptions.
Absolument. Savais-tu qu'on écrit plus de 600 millions d'ordonnances pour des médicaments psychiatriques chaque année?
Oh là là! Mais qu'advient-il des patients qui ne veulent pas de drogue?
Le DSM a aussi une catégorie pour cela, qu'est-ce que tu crois?
Says V15.81, non-compliance with treatment. Now this category can be used when the focus of clinical attention is non-compliance with an important aspect of treatment for a mental disorder or a general medical condition. If you refuse treatment, then you probably are mentally ill, ipso facto, by that fact alone.
Donc, si on ne fait pas ce que dit le psychiatre, c'est un trouble mental.
Tout à fait.
Ça fait carrément peur. Mais pourquoi ne pas suivre le traitement?
Parce que les médicaments que les psychiatres prescrivent peuvent provoquer des réactions physiques graves et très intenses.
Tu veux dire des effets secondaires?
Eh bien, pas exactement.
Drugs really don't have side effects. Drugs only have effects, and we arbitrarily differentiate those effects of the drug that we like, and we say these are the effects of the drug. And those that we don't like, those are the side effects. It's akin to saying that a bomb that comes down on a building kills people and destroys the building, and the military general says, oh, killing of the people is really a side effect. No, you cannot separate out the destroying of the building and the killing of the people. And so these are not side effects, these are direct effects of the drug creating disaster.
People think antidepressants are going to make them happy. But it's not what they do. They numb them down, and then in themselves there's a withdrawal state from the antidepressants.
They just become like robots, some of them. They're not actually able to experience the whole variety and range of human feelings and emotions and work with them and express with them and share them with others. Because once you sort of put somebody on a heavy dose psychotic drug, I mean, you're just dehumanizing them.
These are very potent, very toxic medicines, cause on themselves diabetes, high cholesterol, cause what's called a metabolic syndrome, truncal obesity, premature hardening of the arteries.
They affect the heart and the lungs and the kidneys, and you never know exactly what to expect.
Most psychotropic drugs lead to massive weight gain. Some of them, like olanzapine, for example, can lead to weight gains of 25, 30, even 40 kilos in a year or two, and that is serious.
One of the side effects is it affects your sexual performance abilities.
In people who are on a lot of medication, they're just totally unable to detoxify through their liver, and then other functions of the body shut down one by one.
These drugs have on their labels may increase the risk of suicide and homicide in people who take them. Just like a carton of cigarettes test to say may be hazardous to your health.
And there's cases where many people who commit suicide or commit acts of violence are on these medications, which definitely has this type of side effect.
You look at the side effect profile is identical to what they're trying to treat, and in some cases worse, and especially in the instance of suicide, then you could see that it's an extremely treacherous area with very, very little actual science behind it.
C'est une blague. Ce sont des drogues dangereuses.
C'est sûr. Et des milliers, si ce n'est des millions de gens, ont cherché l'aide d'un psychiatre et ont reçu des drogues qui ont fini par les détruire. Des gens comme Candice, mise sous Zoloft parce qu'elle avait le trac avant des examens. Steven s'est suicidé 19 jours après être mis sous Prozac. Julie voulait aller à l'université, mais s'est pendue après 7 jours de prise de Zoloft. Matthew s'est pendu à l'âge de 13 ans. Matt prenait un cocktail de psychotrope à 21 ans. Kathleen, sous Zoloft et Trazodone. Beth prenait du Paxil pour de l'insomnie. Matt, sous Lexapro. Charles, sous Clozaril. Kathleen, en 6e. Megan, Aaron.
Attends une minute. C'est de la folie. Tu dis bien que tous ces gens qui se sont tués prenaient des médicaments psychiatriques?
Ouais. Le nombre de morts par an liés à des drogues psychiatriques est estimé à 42 000, que ce soit par homicide ou suicide.
C'est plus de 3000 personnes par mois. Il faut retirer ces drogues du marché.
Absolument. Mais comme ces drogues constituent le seul traitement que les psychiatres ont à offrir, ils minimisent les risques. Et ce sont leurs patients qui en subissent les conséquences.
When you get on the psychiatric drugs, you feel just like you don't really want to live anymore. Like, just depressed all the time, and you feel sad.
You don't feel like you're in your own skin. It almost feels like you just want to come out of your skin all the time.
Get really bad headaches, I'd start shaking. I wouldn't sleep very well, I'd have nightmares.
I had started shaking really bad, and it was like uncontrollable, you know? And it's like, I don't understand why I shake so much.
It brought on the symptoms that I was trying to escape from. Very severe.
I'd go through spells where I'd just be completely just dead. There would not be me there. I'd just be standing there and there would be nothing.
I think we all have emotions, happy, sad, you know, situational emotions in life, and it didn't allow me to experience them.
You don't experience tears, you don't experience a lot of laughter. It just makes life real flatline.
I described to a friend of mine as like waking up in a manila folder and it's a cloudy day. Everything is boring, unmemorable, unspecial.
It changed me. It changed who I was. It changed the essence of my personality.
You know, it just started making me worse. And I got in such bad fights with my brother. I scratched his face up and, you know, stuff like that.
I started to experience suicidal ideations almost immediately. And I had never had any feeling like that before.
I remember when I was at home one day, I had taken my medication and I thought about killing myself, and I got really scared, so I ran to my brother and I told him, and he just held me and told me not to give up and to just keep trying.
And I actually thought that's maybe the one thing that I do have control over, that I could, you know, I could off myself, and I would be out of this roller coaster of an existence.
I have been raped. I have been coerced into doing things that I do not care to speak of. But just to put it in perspective, even having experienced that, the experiences in thoughts and loss of self that I had, being put on Prozac was the worst violation I have ever experienced.
Je ne sais plus quoi dire. Les gens n'ont aucune idée de ce que font ces drogues parce qu'ils font confiance à leur psychiatre.
Non seulement ça, mais des études récentes ont montré que les drogues telles que les antidépresseurs ne sont pas plus efficaces qu'un cachet neutre, un placebo.
Donc en résumé, non seulement le DSM fournit l'étiquette que le psychiatre vous donne, mais il justifie la prescription de drogues puissantes mais inefficaces qui ont de nombreux effets secondaires. C'est vraiment affreux.
Absolument. Et pourtant, les psychiatres s'accrochent à l'idée qu'ils peuvent corriger un comportement indésirable avec de la chimie. Bien sûr, la psychiatrie est d'un grand intérêt pour l'industrie pharmaceutique, laquelle peut vendre des psychotropes pour chaque trouble contenu dans le DSM.
J'ai vu leur campagne de marketing, c'est partout.
Oui, mais si tu remarques bien, ils font aussi le marketing des troubles mentaux. Les laboratoires pharmaceutiques font de la publicité pour les troubles du DSM dans la presse, à la télévision et sur Internet, conseillant vivement aux gens de parler à leur docteur. Leurs experts payés parlent de nouvelles épidémies de maladies mentales dans des talk-shows. Ils placent des articles dans les journaux et recrutent des psychiatres pour conduire des études et écrire des papiers qui donnent une apparence scientifique aux troubles mentaux.
Parce que si les gens pensent qu'ils ont le trouble, ils demanderont le psychotrope.
Exactement.
The pharmaceutical industry markets disorders. Because if you can market a disorder, then you've got something to sell your product to treat.
So people suddenly come to think of things they previously didn't regard as a disease state as a disease, go to the doctor, see the psychiatrist then prescribes the drug that the drug companies have received FDA approval for, and everyone is happy except for the patient.
They're all working together, the psychiatrists, the pharmaceuticals, and one feeds the other. So again, job security for the pharmaceuticals and also job security for the psychiatrists.
Il n'y a pas que les laboratoires pharmaceutiques qui font la campagne pour ces maladies. Un psychiatre, Joseph Biederman, a créé et popularisé un trouble appelé bipolaire pédiatrique. Il a déclaré que ce trouble pouvait commencer dès que l'enfant ouvre les yeux.
Bipolaire? Comme saute d'humeur pour les enfants?
Malheureusement, oui. En 9 ans, Dr Biederman a alimenté à lui seul une explosion du nombre d'enfants étiquetés comme étant bipolaires. Et la plupart furent mis sous des antipsychotiques puissants, conçus pour les maladies mentales les plus graves.
Je ne savais pas.
Même le psychiatre qui a rédigé le DSM-4 a admis que celui-ci a contribué à lancer la mode du bipolaire pour enfants.
Well, we learned some very, very painful lessons in doing DSM-4, but inadvertently, I think we helped to trigger 3 false epidemics. One for the childhood diagnosis of bipolar disorder.
Trop tard maintenant, n'est-ce pas?
Pour beaucoup d'enfants, oui. Vu que les psychiatres prétendent que les troubles mentaux tels que bipolaires ne se guérissent pas, ils se sont fait des clients à vie pour eux et l'industrie pharmaceutique.
Donc c'est un partenariat naturel?
Absolument. L'industrie pharmaceutique fournit aux psychiatres des sommes énormes pour la recherche et ceux-ci inventent encore plus de maladies à traiter avec des psychotropes.
Drug companies have become increasingly dependent on mental illness diagnoses in order to maintain their profit margins. And psychiatrists and increasingly clinical psychologists are more than happy to manufacture mental illness in order to make that happen. Hence, the increase in size of the Diagnostic and Statistical Manual of Mental Disorders.
The strategy is how many people we can diagnose with a particular label that would be broad enough to include a ton of people in it. And the mentality behind that is the sale of the pharmaceutical drug, which eventually becomes the treatment.
These drug companies are making a lot of money, and they're spilling that money and sending that money to people that will help support their cause. So it's not a surprise at all that they have infiltrated so many of the committees within the DSM and so much of our own medical education.
Attends. L'industrie pharmaceutique a infiltré les comités de psychiatres qui décident quels troubles ajouter dans le prochain DSM?
Dans le DSM-4, 56% des membres du comité avaient des liens financiers personnels avec l'industrie pharmaceutique. L'industrie qui allait profiter des 115 maladies mentales supplémentaires qui ont été votées.
Et bien sûr, on a de plus en plus de maladies qui seront traitées avec les drogues.
Et encore plus de symptômes pour chacune.
The whole world is being made crazy, really. We have these proliferation of categories which have become more and more encompassing, encroaching in ordinary everyday life.
There isn't a human being on the planet who doesn't have at some point, if not several points, in a day or a week, distress. It's part of being human. But to say that because you have this distress, that you now are diseased?
If you take a god man in India who wanders around with a shawl and meditates for 17 hours a day, drinks rainwater and engages in some kind of spiritual or religious discipline or practice where he might roll on the ground for 100 miles to a holy place, people there don't persecute those individuals. They accept them as people engaged in religious practices. But here, if you took those same individuals in India and you had them walk across a campus in America, they would immediately be arrested and put into a psychiatric facility because they're manifesting psychosis. This varies by culture.
What do we want to straitjacket everybody? Is everyone going to be the same? What about people that do have a little bit odd behavior? Is a little odd behavior bad or dangerous? It's just different.
You want this thing to cover, all manner of aberrant human behavior. So if you can cover every bit of it, then you're going to have the best chance possible to a billable unit of service.
Et d'ailleurs, si aucune de leurs catégories ne convient pour vous, il y en a une autre dans laquelle ils peuvent vous caser.
Naturellement.
This is number 301.9.
312.9. 292.9.
Bipolar disorder, not otherwise specified.
Gender identity disorder, not otherwise specified.
Disorder of infancy, childhood, or adolescence, not otherwise specified.
Not otherwise specified.
What the hell does that say? They don't know.
It's kind of like a catch-all.
It's the garbage can for the leftovers.
There's even a box for people that don't fit in the other boxes.
To me, it's insane.
This is like rubbish to me.
This is scary to me.
This is hackery, quackery, dockery.
Qu'il faille créer une catégorie divers pour ce qui reste démontre la médiocrité de cette science.
Tout à fait. Comme le trouble de l'attention et hyperactivité sans précision, trouble de l'alimentation sans précision, trouble de l'humeur sans précision.
You can always use the NOS, the not otherwise specified diagnosis, and that's a billable service.
Not otherwise specified means that you're sort of at sea to some extent on the exact diagnosis, meaning it doesn't fit into any of the categories you've established.
Unspecified mental disorder. You see, that's considered a disorder. Having nothing wrong with you is now a disorder. That's what this says. Can you believe it?
Non, je ne peux pas y croire. Il y a une catégorie trouble mental sans autre indication? Autant dire, et on va pas vous la décrire. C'est une maladie mentale aussi?
Pire encore, selon le DSM, vous pourriez avoir comme diagnostic une maladie mentale non listée.
Sans blague.
Tiens, écoute ça.
These diagnostic criteria and the DSM-4 classification of mental disorders reflect a consensus of current formulations of evolving knowledge in our field. They do not encompass, however, all the conditions for which people may be treated or that may be appropriate topics for research efforts.
Even in the language of the introduction, it's basically saying we're trying to have a diagnosis to cover all the bases of anything that somebody could come in complaining about, which is, again, entirely backwards from how medical diagnoses are come to.
Ce DSM n'a rien à voir avec la médecine.
Non, c'est du marketing pur et simple.